Headaches are a common health complaint, but not all headaches are created equal. Two types that often confuse people are hypertension headaches and migraines. While both can cause intense pain and disrupt daily life, their causes, symptoms, and treatments differ significantly. Understanding these differences is essential to managing your health effectively and seeking the right care. Hypertension headaches are directly related to high blood pressure, a condition that silently damages blood vessels and organs if left unchecked. These headaches typically arise when blood pressure spikes to dangerous levels, putting strain on the brain's blood vessels. They serve as important warning signs that your cardiovascular health needs attention. Migraines, on the other hand, are neurological events involving complex changes in the brain's chemistry and blood flow. They often present with throbbing pain, sensitivity to light and sound, nausea, and visual disturbances. Unlike hypertension headaches, migraines can occur even in people with normal blood pressure and may be triggered by various factors such as stress, diet, or hormonal changes. In this video, we'll explore the key differences between hypertension headaches and migraines. We'll discuss how to recognize each type, when to seek medical help, and the best approaches to treatment and prevention. Knowing which headache you're experiencing can guide you toward effective relief and protect your overall health. Stay with us as we unravel the mysteries behind these two types of headaches and empower you with knowledge to manage them confidently. 1. Overview of hypertension headaches. Hypertension headaches are a specific type of headache directly linked to elevated blood pressure. These headaches often serve as an important warning sign indicating that blood pressure has reached dangerously high levels that could threaten vital organs such as the heart, brain, and kidneys. Understanding the characteristics of hypertension headaches helps in recognizing when urgent medical evaluation is necessary. Hypertension, or high blood pressure, means that the force of blood pushing against the walls of your arteries is consistently too high. This increased pressure strains blood vessels throughout the body, including those in the brain. When blood pressure spikes abruptly or remains elevated over time, it can cause blood vessels in the brain to swell or stretch, triggering headaches. Typically, hypertension headaches are described as a dull, throbbing pain. They often occur in the morning, especially upon waking, when blood pressure naturally tends to peak due to the body's circadian rhythms. Many people report feeling these headaches around the back of the head or in the temples. The pain may intensify with physical activity or when bending over, and usually does not respond well to common over-the-counter pain medications. Unlike other types of headaches, hypertension headaches often coincide with other symptoms of dangerously high blood pressure such as dizziness, blurred vision, chest discomfort, or shortness of breath. If these symptoms accompany the headache, it indicates an urgent need for medical attention to prevent complications like stroke or heart attack. Importantly, not everyone with high blood pressure experiences headaches, and the absence of headache does not mean blood pressure is under control. Many people have silent hypertension, where blood pressure causes damage without any symptoms. Hypertension headaches are often seen in hypertensive crises, where blood pressure exceeds 180-120 mmHg, posing immediate health risks. In such situations, headaches may be severe and sudden, accompanied by other alarming signs like confusion, difficulty speaking, or weakness signaling a medical emergency. Managing hypertension headaches involves controlling blood pressure through lifestyle changes and medication. Dietary modifications, such as reducing salt intake, regular exercise, stress management, and adherence to prescribed antihypertensive drugs are critical components. Regular blood pressure monitoring helps prevent dangerous spikes that can trigger headaches. In summary, hypertension headaches are a symptom of dangerously high blood pressure, characterized by dull, throbbing pain, often felt in the morning and worsened by activity. Recognizing these headaches, especially when accompanied by other warning signs, is vital for timely intervention and preventing serious health consequences. 2. Understanding migraine symptoms. Migraines are a complex neurological disorder that affects millions of people worldwide, characterized by recurring episodes of moderate to severe headache pain, often accompanied by other symptoms. Unlike hypertension headaches, migraines are not directly caused by blood pressure changes, but result from intricate changes in the brain's chemistry and nervous system. A migraine typically begins with a throbbing or pulsating pain, often localized on one side of the head, although it can affect both sides. The pain is usually moderate to severe and can last anywhere from a few hours to several days. This headache intensity often interferes with daily activities, forcing individuals to seek rest in a quiet, dark room. Migraines are commonly accompanied by sensitivity to light, sound, and sometimes smell. Many sufferers experience nausea and vomiting, which further complicate the discomfort. Visual disturbances known as aura may precede or accompany the headache phase. Aura can include flashing lights, zigzag lines, blind spots, or other visual anomalies. The exact cause of migraines remains unclear, but they are believed to involve abnormal brain activity that affects nerve signaling and blood flow. Several triggers can provoke migraines, including stress hormonal changes, certain foods and beverages, dehydration, sleep disturbances, and environmental factors like bright lights or strong odors. Unlike hypertension headaches, migraines often have identifiable triggers and follow a pattern or cycle, with some people experiencing prodromal symptoms such as mood changes, food cravings, or neck stiffness before the headache starts. Migraines are diagnosed primarily based on clinical history and symptom patterns, as there are no specific tests to confirm them. Treatment usually involves both acute management to relieve pain during an attack and preventive strategies to reduce frequency and severity. Medications such as triptans, anti-inflammatory drugs, and anti-nausea treatments can provide relief during migraine attacks. Preventive medications, lifestyle modifications, stress management, and avoiding known triggers play key roles in long-term migraine control. In summary, migraines are a neurological condition characterized by intense, often unilateral headache pain accompanied by nausea, sensitivity to light and sound, and sometimes visual aura. Understanding these symptoms helps distinguish migraines from other headache types like hypertension headaches and guides effective management. 3. Key differences between hypertension headaches and migraines. Understanding the key differences between hypertension headaches and migraines is crucial for accurate diagnosis and appropriate treatment. While both types of headaches can cause significant discomfort, they differ in their underlying causes, symptoms, duration, and response to treatment. One of the primary distinctions lies in the cause. Hypertension headaches are directly related to elevated blood pressure, especially when it reaches dangerously high levels. The increased pressure affects blood vessels in the brain, leading to headaches. Migraines, however, are neurological in origin, caused by abnormal brain activity that affects nerve signaling and blood flow independent of blood pressure levels. Symptomatically, hypertension headaches tend to present as a dull, throbbing pain, often located in the back of the head or temples. They are typically persistent, occurring in the morning when blood pressure peaks, and may worsen with physical exertion or changes in posture. Migraines usually involve a more intense pulsating pain, often localized on one side of the head. Migraines are frequently accompanied by additional symptoms, such as nausea, vomiting, sensitivity to light and sound, and visual aura, which are uncommon in hypertension headaches. Duration also varies significantly between the two. Hypertension headaches may last for hours, but generally resolve once blood pressure is controlled. Migraines can last anywhere from several hours to several days and tend to follow a predictable pattern or cycle, sometimes with prodromal symptoms days before onset. Response to treatment provides another important difference. Hypertension headaches often do not respond well to typical over-the-counter pain relievers unless blood pressure is effectively managed. In contrast, migraines may respond to specific medications like triptans or anti-inflammatory drugs, and often require targeted preventive therapies. The presence of other symptoms is a helpful clue. Hypertension headaches may coincide with symptoms of elevated blood pressure, such as dizziness, blurred vision, chest discomfort, or shortness of breath. Migraines primarily involve neurological symptoms like aura tingling sensations or mood changes. It's also important to note that some individuals with hypertension may experience migraines complicating the clinical picture. Therefore, thorough medical evaluation and monitoring are essential for proper diagnosis. In summary, hypertension, headaches, and migraines differ in cause, symptom profile, duration, and treatment response. Recognizing these distinctions helps ensure timely, appropriate care and better management of both conditions. 4. When to seek medical attention. Knowing when to seek medical attention for headaches is vital, especially when distinguishing between hypertension headaches and migraines. While many headaches are benign and manageable at home, certain signs and symptoms signal the need for prompt professional evaluation to prevent serious complications. If you experience a sudden severe headache unlike any you've had before, it warrants immediate medical attention. This type of headache can be a sign of a hypertensive crisis, a dangerous spike in blood pressure that can lead to stroke, heart attack, or organ damage. Accompanying symptoms such as confusion, weakness, difficulty speaking, vision, changes, chest pain, or shortness of breath further increase the urgency. Persistent headaches accompanied by consistently elevated blood pressure readings also require medical evaluation. If you notice that your headaches occur mainly in the morning and are resistant to over-the-counter medications, it may indicate poorly controlled hypertension needing adjustment of treatment. Migraines that significantly interfere with daily life, occur more than once a week, or do not respond to usual treatments should prompt a visit to a healthcare provider. New or worsening neurological symptoms, such as aura lasting longer than usual, loss of consciousness, or seizures, demand immediate care. Any headache occurring after head trauma, especially if accompanied by vomiting, dizziness, or loss of coordination, is a medical emergency. Similarly, headaches in individuals with a history of cancer, immunodeficiency, or systemic illness require urgent assessment. For both hypertension headaches and migraines, regular medical follow-up is crucial. Blood pressure monitoring, lifestyle assessment, and medication adjustments help manage hypertension effectively, reducing headache frequency and severity. Migraine management may involve preventive therapies and trigger avoidance strategies. If you are unsure about your headache type or experience frequent, severe, or changing headache patterns, consult your healthcare provider. Early diagnosis and tailored treatment improve quality of life and reduce the risk of complications. In conclusion, seek medical attention for sudden severe headaches, persistent symptoms with high blood pressure, frequent or disabling migraines, or any new neurological signs. Timely evaluation ensures appropriate management and protects your health. 5. Managing and preventing both conditions. Effectively, managing and preventing hypertension, headaches, and migraines requires a comprehensive approach that addresses the unique causes and triggers of each condition while promoting overall health and well-being. Understanding how to balance treatment strategies can significantly reduce the frequency and severity of headaches and improve quality of life. For hypertension, headaches controlling blood pressure is paramount. Lifestyle modifications such as adopting a heart-healthy diet low in sodium, engaging in regular physical activity, managing stress, limiting alcohol consumption, and quitting smoking are foundational steps. Consistent adherence to prescribed antihypertensive medications is critical to prevent dangerous blood pressure spikes that can trigger headaches. Regular monitoring ensures blood pressure remains within a safe range. In contrast, managing migraines often involves identifying and avoiding individual triggers, which can vary widely among sufferers. Common triggers include certain foods, stress hormonal changes, sleep disturbances, and environmental factors like bright lights or loud noises. Keeping a headache diary can help track patterns and inform preventive strategies. Medications for migraines include acute treatments such as triptans and anti-inflammatory drugs to relieve pain during attacks and preventive medications to reduce their frequency and intensity. Non-pharmacological therapies like biofeedback, cognitive behavioral therapy, and relaxation techniques also play an important role in managing migraines. Stress management benefits both conditions. Techniques such as mindfulness meditation, deep breathing exercises, yoga, and adequate sleep improve vascular health and reduce the likelihood of headache onset. Addressing stress helps break the cycle where stress triggers headaches and headaches increase stress. Regular medical follow-up is essential to tailor treatment plans, monitor progress, and adjust therapies as needed. Combining lifestyle changes, medication adherence, and stress reduction creates a synergistic effect that enhances outcomes. Additionally, staying informed about your health, recognizing early symptoms, and seeking timely care empower you to manage both hypertension headaches and migraines proactively. In summary, managing and preventing hypertension headaches and migraines involves a blend of blood pressure, control, trigger, avoidance, medication, stress management, and regular healthcare engagement. This integrated approach supports healthier headache-free living. Distinguishing between hypertension headaches and migraines is crucial for effective management and prevention. Each condition requires a tailored approach to treatment, lifestyle adjustments, and stress management. Understanding their key differences empowers you to recognize symptoms early and seek appropriate care, protecting your overall health and quality of life. At Active Healthcare, we strive to provide clear, reliable information and practical guidance to help you navigate health challenges with confidence. Our channel offers expert insights and personalized advice, especially for adults over 50 who want to maintain vibrant, healthy lives. If this video helped you better understand hypertension, headaches, and migraines, please subscribe to Active Healthcare and tap the notification bell so you never miss our latest health tips. Sharing this knowledge can support your loved ones in managing their health more effectively. Remember, your well-being is your greatest asset. Stay informed, stay proactive, and partner with healthcare professionals for a healthier tomorrow. Together with Active Healthcare, you can take meaningful steps toward a brighter, headache-free future.